Hi, my name is Jamie Shulak, Program Coordinator for the Respiratory Therapy Program at UNCW. We are housed in the School of Health and Applied Human Sciences in the College of Health and Human Services. This program will be the first entry-level bachelor's degree program in respiratory therapy offered within the state of North Carolina and will be serving our community. You know, for me, at the time I decided to become a respiratory therapist, I was in recreation and leisure. I was a waterfront director and lifeguard at Florida State University. But I knew I wanted to enter the healthcare field and was able to find a respiratory therapy program at my local college. I didn't know anything about the profession, but it seemed exciting, and it was. After obtaining my degree, I went to the University of Central Florida to complete my bachelor's degree in cardiopulmonary sciences. I later earned my master's degree in Northeastern University in respiratory care leadership in Boston, Massachusetts. Now, my professional work began as I entered Orlando at a pediatric home care company. I worked with premature infants as part of a discharge planning team going into the ICU to provide education, equipment, and technical support for families who wanted to go home safely. My professional journey took me to Orlando Regional Medical Center after that. It was Central Florida's only Level 1 trauma center. I enjoyed the show Trauma Life in the ER. As a young adult, and they filmed at ORMC on several occasions, which was attracting. I worked in all areas of the hospital, including the emergency department, the trauma ICU, the neuro ICU, the medical and cardiac ICU, and I supported non-critical care areas as well. I worked everywhere and I loved it. It was exciting. It was challenging. I worked with attending physicians. I taught residents. I would work alongside nurses, dietitians, physical therapists, pharmacists, radiologic technicians, and other healthcare providers. We were a team. My role was unique and critical to patient outcomes, particularly in the ICU. I began precepting students who came to the ICU from respiratory therapy programs in our region. My teaching career soon started at Seminole State College as a part-time faculty member while maintaining my full-time role at ORMC. I taught lab courses and conducted simulation to support student learning. Soon after, I took on the Director of Clinical Education role full-time at Valencia College. I coordinated all of the student clinical experiences. I was promoted to the program chair role and directed the program while maintaining a teaching load. But throughout my time, I continued to work at Orlando Regional Medical Center to maintain my skills and connection to the profession. I worked the weekend of the Pulse nightclub tragedy alongside my graduates with physicians, nurses, and the entire healthcare team. I supported the community. It was the epitome of caregiving, teamwork, and practice within the backdrop of a community in pain. Needless to say, we were all proud to serve, provide care, and be a part of the healing process. Now, we find our profession at the forefront of conversations that involve mechanical ventilation. During this COVID-19 pandemic, I agreed to work through the first wave of the pandemic at ORMC. The community support and pride was inspiring. However, it was my time to leave to start my doctoral degree in higher education and move to Wilmington to start this new program. You know, I want to share some information with you about the profession and our respiratory therapy program. There are approximately 130,000 respiratory therapists in the United States. According to the Bureau of Labor and Statistics, the mean annual wage is over $62,000, and the mean hourly rate is $29 an hour. Demand within our profession has and will remain high, averaging 20% for many years. Most respiratory therapists work in general medical or surgical hospitals. Some respiratory therapists work in specialty hospitals or skilled nursing facilities. Other therapists may work in physician offices or rental and leasing services, supporting the distribution of durable medical equipment and education for patients in the community or at home. Now, respiratory therapists also work in diagnostic labs as pulmonary function technologists, studying lung disease and helping doctors diagnose what's happening, or as sleep specialists studying polysomnography or sleep disorder. Beyond this list, there are respiratory therapists who work in education like myself, in research centers, as well as medical sales for national and international corporations. You may be asking yourself, what do respiratory therapists do? Ultimately, respiratory therapists assess, treat, and care for patients with breathing disorders. Now, these breathing disorders can be caused from lung disease, obviously, but cardiac disease, renal disease, or other conditions that lead to a chemical imbalance within the body affecting the cardiopulmonary system. Respiratory therapists work with all types of patients that include neonatal patients or newborns, pediatric patients or children, and adult patients, particularly the elderly and vulnerable. We serve all patients in the hospital when the need arises, using mechanical ventilators if needed for life support. The respiratory therapist plays an integral part in critical care management of patients in the intensive care unit. Mechanical ventilators in the ICU are operated by a respiratory therapist, assisting the physician and working alongside nursing. Respiratory therapists work in non-critical care areas as well by providing diagnostic, therapeutic, and rehabilitative services for patients. Now, the work is rewarding. It is challenging, but it is exciting. Each year, we're going to accept a group of 20 students to start in the fall term. Prerequisite courses needed for admissions will include Bio 201 and MAT 111, or equivalent courses with a C or higher. An overall minimum GPA of 2.5 is required for admissions. Other requirements are being finalized for admissions that you can learn about later. We are going to focus on the student experience within this program. That includes curriculum that supports respiratory therapy students entering the profession. The curriculum is rigorous, but students will experience the support over the 4 semesters that include lecture, lab, and clinical practice. We will introduce, reinforce, and assess concepts needed to practice medicine as a respiratory therapist in advance of you going to clinicals. We will foster a co-curricular experience and academic home that helps ensure the success of every student entering our program. We will provide and promote mentorship between students and faculty and among the student body that is learning-centered, right? Graduates will be able to obtain a national credential in a registered respiratory therapist, registered respiratory therapist, and apply that for licensure throughout the country, whatever state you choose. Additional professional credentials are available to registered respiratory therapists. Now, master's programs are also available in education, leadership, and a few in clinical residency, which will also be available for our graduates who pursue advanced academic credentials. Now, the respiratory therapy profession is challenging and rewarding. It requires critical thinking and compassion. If you want to enter the healthcare profession, if you want to be a caregiver, if you want to save lives from time to time, just consider respiratory therapy. Thank you.